All right. So hi everyone. Huge thank you to our panelists for joining us today. I know it's a lot easier to come back and speak with us via Zoom, but we appreciate it so much. Um, so I think you all know me, but my name is Sarah Prisky. I'm the pre-health advisor here at Simmons, and I've been super excited to work with these alums, either as students or alumni or both, on their paths to graduate school. So I'm really excited to welcome all five of you here and to share your wisdom after taking some time from Simmons before applying to graduate school. And I know we have some successes to celebrate here as well. So hopefully we can celebrate those a little bit. So I'm going to kind of go clockwise in the direction that you are all on my screen. So Sarah, would you mind introducing yourself and starting things off?
Alrighty, well, thanks for having me here. My name's Sarah Bahai. Let's see, my pronouns are she, her, hers. I graduated in 2018 with a major in biology and a minor in English. And let's see what I've been up to. So it's been 3 years, or like, yeah, no, 3 years now. That's weird. Um, so right after graduation, I moved out to Los Angeles. I worked in a dialysis clinic while I was out there, and then I did research. And then I kind of decided to get serious about applying to medical school, and I came back home to Maine, where I took physics and biochem, which I didn't complete while I was at Simmons. So took those, studied for my MCAT, and I literally took my MCAT a year ago, 2 days, like on March 14th. It was the last day before everything just like hit the fan, you know? So yeah, applied this year. So I've gotten into medical school at this point, which is like amazing to say. So yeah. I guess that's what I've been up to. Right now, I'm working at a school for children who have developmental disabilities. A lot of the children I work with are on the autism spectrum, but it's been really rewarding, really fun. And yeah, so I'm excited to be here.
Awesome. Thank you, Sarah. Shay, would you mind going next?
Sure thing. Hi, my name is Shay. I use they, them, theirs pronouns. I graduated in 2019. I was an exercise science major because I started off PT with a chemistry minor. And since graduating, I actually got a job where I had interned my senior year. I have been working at the Fenway Institute at Fenway Health here in Boston. Working in their clinical research, which has historically been HIV focused, but now we're doing some COVID work too. Started off as an RA, got promoted to study coordinator for this, this year, and I now run 7 studies at work, and a lot of HIV prevention, working with the LGBT community, and then also some COVID prevention studies as well.
Awesome. Thanks, Shay. And you've been applying to medical school.
Oh yeah, the big point, the whole point. Yeah, I applied this application session, and I have gotten into med school, which is exciting. And yeah.
Awesome. Thanks so much. Jenny, you are next on my screen.
Hi, I'm Jenny. My pronouns are she, her. I graduated 2016 with a major in biochemistry and minor in physics. I guess it's been like 5 years now because I got the 5-year reunion email. As of late, I've been working as a medical assistant in a surgical specialties department. I've been working with a bunch of doctors and rotating in between different specialties with like colorectal, urology, thyroid, and I get to like assist with the doctors in the different procedures. I have been doing a lot of different experiences with patients. So I've been like a patient care technician. I've worked in a hospital, but initially when I graduated, I was a research technician because I had thought I wanted to go to grad school. But I recently just got accepted into PA school, so I'm really excited to start in August.
This is such a happy celebratory panel. Thank you, Jenny. Asha has something different but equally amazing to celebrate.
Hi, my name is Asha Salah. My pronouns are she, her, hers. I graduated Simmons in 2019. I majored in biology and I minored in chem. And since graduating, I completed my Master of Public Health program this past January. I applied for it maybe like a couple months after graduating. I didn't know that I wanted to go to. I was debating it, but I like clicked send and everything worked out for the best. Since graduating in January, the day I graduated, I started being a teaching assistant for one of the mobile health classes at Boston University School of Public Health. And I've also been a patient experience representative at Boston Children's Hospital for a little bit over a year, like almost a year and a half now. I'm running shy from it. Can say I've worked at almost every single hospital in Boston, or at least in the Longwood area, so that's cool. And I'm applying to medical school. This is try number 3. The first 2 tries I prepared for it, but I just never clicked submit. I keep shying away from myself, so I'm kind of like amping myself up to get ready. But I feel like since my growth here, I've completely grown as a person. I feel like this is my year, so I'm excited for that.
We are super excited for you as well. Can't wait to work with you this cycle. Zahra, last but not least.
Yeah, so my name is Zahra. I use she, her, her pronouns. I graduated in 2018.
Oops, Zahra, you keep going in and out a little bit. You sounds like you're a little far away from the mic, maybe.
Yeah, I am.
There you go.
So I'll start over. So my name is Zahra. I use she, her, hers pronouns. I graduated in 2019 from Simmons. I majored in biochem, math, and biostats, and did a minor in physics. I got a job at Princeton right after graduation and worked in research for 2 years in neuroscience, and then applied to medical school, I guess like almost like a year and a half ago now. So I mostly applied to MD PhD programs because that is what I wanted to do, and some MD programs, and then got in to a couple of places and decided to come to WashU. So I am now in my graduate phase of training at WashU. So I'm like doing the PhD or doing some aspects of the PhD, and then I'm gonna start medical school in September. So yeah.
Super exciting. You also get a cheer icon because that is also super exciting. Awesome. Thank you all so much for being here. I was so excited to be able to get students who have such a diverse range of experiences because I think we have a little bit of everything, which is really awesome. So I told you all that this is what I was going to ask. One of my first questions for you is when you came into Simmons as a first-year student, what was your plan and how did that change over time? I'd love to kind of give an illustration of how plans can change, and that's okay. Does anyone want to go first, or would you rather I go clockwise again?
I guess I can go first.
All right, Zahra, all yours.
So I was pretty sure I wanted to go to medical school as a first-year student. I was a pre-med major, or I was in the pre-med program and did all the required coursework when I was at Simmons. But I didn't really know that I liked research so much. I kind of did research as a way to like get into medical school.
Zahra, your mic's going in and out again.
Oh, is it better now?
Yeah.
I don't know what I can do.
Thank you.
Let me also make sure that my microphone is this better?
Yes, much better.
Okay. Cool. So, sorry, I'll start over. But I was just saying that I was pretty sure I wanted to go to medical school as a first-year student. But I didn't realize that I liked research so much until I actually started doing it. And then, and I was just doing it as a way to like sort of prepare for medical school. So I think what was cool about my growth year is that like I got to do like research full time and sort of like experience like what it's like to do science independently. And I think that really was like an important factor in like picking whether to do an MD PhD program or just like an MD program. Yeah.
Thanks so much. Anyone else want to go next? Yeah, Shay, you're up.
Yeah, I can go. I feel like my well, I'll just say I entered into Simmons as an accepted into the 6-year doctorate of physical therapy program, and got 3 years into that, and realized this is not what I want to do. I want to go to medical school. I want to, be pre-med. So, beginning of junior year, I made all of the changes necessary, switched classes, all that fun stuff, and was able to squeeze in just the right amount of classes to get all of the prereqs in before graduating, which was great and kind of lucky, probably. But I stuck with my exercise science major, thinking, it's not a bad major to have going into med school. And I didn't have time to do anything other than that. And I kind of then was forced into taking a growth year because there was no way that I could learn all of the material for the MCAT without having gone through the classes first. Which was absolutely great for me because I don't think I would have done a good job at applying while I was in school. So it kind of forced me into the best case scenario. And I was able to be working full time while prepping for the MCATs, and doing applications. And the research experience has been absolutely amazing. It has allowed me a lot of patient interactions. I work with patients every day. And then also a lot of leadership growth, an understanding of clinical research, all that stuff, professional development, all that fun stuff. And yeah, that's kind of where I started and where I am.
Thanks so much, Shay. Shay, would you mind sharing a little bit of what the patient interaction looks like for you? Because I know we say clinical research a lot, and a lot of folks hear research and they think like pipettes, right? And bench research. So can you talk a little bit about what that looks like in terms of patient interaction?
Yeah, absolutely. So I'll talk mostly about the HIV work that I do. I'm working on, the studies that I was mostly on were prevention studies. So talking about HIV PrEP, and some vaccines as well. And we see patients for visits ranging from like 1 year of a study through like one of our biggest studies that I'm leading now is like 4 years long. So we have people coming in. And basically my clinical interaction with them is I'll do vitals with them, I'll do blood draws, we do HIV risk reduction counseling, we do adherence counseling, and then all of that is like we report to the providers who then sign off on scripts, we get the medication, and we send them on their way. So I get to kind of I've had a lot of practice on how to kind of build rapport with patients, and also adjust how I communicate to educate and counsel folks on risk reduction and adherence to medication and stuff like that. And it's been absolutely great. I think it will go a long way in, in how I interact with people once I get to med school and I'm doing, patient interactions in that capacity as well.
Awesome. Thanks so much. That's a question I get a lot. So I just wanted to make sure to jump on that when you mentioned it. Does anyone else want to talk about their path from like what they thought they were going to do as a first year student? Yeah.
I guess I should
go ahead, Sarah. Jenny, you're next.
Yeah. Well, so I had a very I would say untraditional path, or non-traditional, I guess is the term. I started out as an English major thinking that I was going to be an English teacher. I remember going into my first year, I thought I needed to commit to either science or English, and I was so worried about being behind that I needed to commit to one and not explore both, which ended up being a mistake because I picked the wrong one. Then I was behind, and I didn't switch until halfway through my sophomore year, so it was kind of like a struggle to to get everything in by the time I graduated. But like Shay, it was kind of a race and almost like a puzzle, trying to fit all the classes in, but got the biology degree, so that was good. But obviously I didn't complete everything that I needed for medical school, and I guess throughout the 4 years, it was kind of like a constantly evolving, do I want to go to med school? Do I maybe want to go to nursing school? Do I want to be a PA? So it was definitely important for me to take a gap year or growth year. And yeah, growth year is definitely what I would call it, because I've just grown so much in the time that I've been out of school. And I think that without the experiences that I've had during that time, I don't think I would have honestly gotten into medical school, especially if I had applied right out of college. It wouldn't have been as I wouldn't have been as successful as I was. So yeah, I guess it was definitely different from what I envisioned my first year, and even different from what I envisioned when I had graduated, because it's been 3 years now, and it's been kind of like a winding path, but it's I have been accepted, and it's it's possible.
Thanks so much, Sarah. Jenny, you are up.
Okay. When I came in as a first year, I was initially pre-med. So I had thought I wanted to go to medical school, and I had really set my eyes forward on going to medical school. But I think as the time to take the MCAT kept coming closer and closer, and I ended up not wanting to take the MCAT, and I didn't know if I wanted to commit to going to more school. And towards the middle of it, I had met a PA, and during one of these networking events, I had met a PA there, and I learned about the PA profession, and I got really into it. But by the end of senior year, I had taken a drug discovery class, and I did my thesis at the Harvard School of Public Health, and I was really dead set on research. So then I was struggling between doing or grad school, and I had been I felt like when I graduated, I was in such a crossroads. So I had just decided to research, and I had focused all of my energy on research, and then after I had gotten a job as a research tech doing bench work for HIV vaccines. And it turned out that I hated being in a lab, and I hated doing pipette work and working with mice and sort of just being in this solo box in a lab. But I had really loved the work that I did, and I knew that my work was important, and I still love science. So I had switched back, took a 180 and got my CNA license, and started working at BI, working as a PCT on the hematology oncology floor. And that experience really taught me that I really enjoyed building connections with patients and like really helping them solve problems and trying to help them work through like whatever they're going through. And it was that really showed me that like this is where I want to be, and like working in medicine is like what I want to do. And that's how I sort of gotten back to applying to PA school. And now that this is actually my time applying, and I recently just got accepted, so I'm really excited to start school.
Yeah, we're super excited for you. Jenny, do you mind if I ask, were you able to get your medical assistant job with your CNA license, or is that like a different training you had to go through for your medical assistant role?
Yeah, at BI, they allow like CNAs or like EMTs to become medical assistants, but I did know that applying to different hospitals, they rather you have a certified medical assistant. But luckily, because I was like at the hospital, I was able to like get a job, and it was super easy because people were telling that it's been really hard getting a job during the pandemic.
Yeah, thanks so much for sharing that. That's really good to know. I get those types of questions a lot. Asha, do you want to talk a little bit about your journey through Simmons?
Yeah. So I knew I wanted to go to medical school when I was 14. I like went on a trip to Somalia with my family for the first time. I like got to meet my family, so it was like a whole cultural experience. But I also got introduced to female genital mutilation, FGM. So long story short, like people passed in front of me, and I was like, well, it sucks that they're not giving the help they needed. There's not enough medical care around the area, even though one of my family members was. So I was like, I'm gonna go to medical school. So I did the whole AP bio in high school and whatnot. And I came in my first year, like, I'm gonna major in bio, and I'm going to I'm gonna apply straight after, well, at least before college, and then go to medical school completely straight, no gaps. It didn't work out that way. I struggled my first year, and I think it was just a combination of imposter syndrome. I had major imposter syndrome, and I feel like high school didn't really prepare me well for college. I've been working in a hospital since I was 15 years old, so I thought I could manage going to school and working at the same time, and I wasn't able to. So like after a lot of tears, lost scholarships, I kind of, during my second year of Simmons, just kind of like picked myself up with the bootstraps, stopped working, focused on like learning how to study and figuring out like how I am able to learn. I feel like I'm in love with biology. I'm happy I did my biology major. I'm studying for the MCAT right now, and I feel like biology is like like the subject that I enjoy like recapping in my MCAT. I did like a little bit of internships every single summer while I was at Simmons, and everyone at Simmons kind of likes doing research, and I just don't. I hate I hate being in a lab. I tried being in a lab studying endometriosis for my capstone. I hated it. I tried straight after graduating being in a public health research like office. I hated the environment, but I loved the topics and what I was doing. I think maybe in 2018 when I was a junior, that was the first time I decided, and it was kind of late. Actually, I decided in February that I was gonna like apply to medical school that year, and it was a big mistake. And this was before I met Sarah. And Sarah was like, you should slow down. And I'm like, no, this is like my plan. I'm gonna do it. You can't stop me. Bad idea. That was the first time I ever took my MCAT, and I did completely horrible. Like, imagine like something that's bad. I did worse than that. And that kind of like took a toll on my confidence. Like I spent the first 2 years of Simmons kind of building up my confidence, getting out of my imposter syndrome, bettering my grades. And then after that, it just tanked, and it made me question like, well, should I actually go to medical school? Like when I look at my self-worth and like your confidence and like, am I able to do that? And I compare it to what other, like my friends are like, oh my God, you're doing so good in your classes. They kind of were just matching up with each other. So me and Sarah just talked a little. I took a year off. Well, I'm still in school, so this was like my senior year. And then I decided, you know what, I'm gonna study for the MCAT my second time. And I feel like I went my hardest. I made a plan. I went on calendars. I was taking the Kaplan course at the time, so they give, I don't remember what the wording is, but they let you take it again. And I did worse than my first time. And I kind of like, I don't know, I spiraled into depression, kind of like ghosted the Simmons advising office, which is bad, but I tried to like, I feel like my mindset at the time was I'm gonna try for my second time. And if it doesn't happen, then whatever, it will work and we'll travel the world, because I spent every single spring break at Simmons in the library and I've never had a break. So then, yeah, the second time I did worse. And then I graduated from Simmons and I was like panicking a little bit because I didn't know what I was going to do. But I feel like that's when I started just like telling myself that no matter where you end up in the world and in life, you'll be fine. So don't like stress about it. My friend Heidi and Sarah kind of like introduced me to the realm of public health. I heard of public health like in the backgrounds, and I didn't know what it was. And when I applied for my master's in public health, I wasn't completely sure what it was, but I knew that it covered a lot of about discrimination, health inequities. And the reason I say I don't like research and like being in a lab is because I like people. I like talking to people. I like solving problems in people's lives. And I felt like, well, if that's what public health is, let me go that route. I wasn't thinking that like a master's in public health would help me get into medical school. I used it as a, if I get a public health, then that's something that I'd be happy doing for the rest of my life. And if I get a medical degree, that's even better, because then I can combine both of them and I can just work in the intersection between both. So yeah, I feel like my time at Simmons was just kind of like a lot of self-discovery, figuring out how to learn, figuring out what path I wanted to be in, a support system. I feel like when you're at Simmons, your support system is your friends and your teachers. But then once I left, they're gone. So yeah, my experience was like ups and downs, and it was a roller coaster. But I feel like if I didn't go through all of those things and I didn't have my growth year, like 19-year-old or 21-year-old Asha is different than like me. I'm 23 now, and I feel like I'm in a way better place. And I grew. I don't know if that answered the question of.
It 100% does. And thank you, Asha, for sharing your experience, because I know I have so many students who have really similar ones, and I totally feel the imposter syndrome. I think everyone was nodding when you were saying that. And I really appreciate you sharing. I also, one thing I really want to highlight that you said was that you got the master's in public health because you wanted a master's in public health, right? And you could see yourself working in public health. It was something that you're passionate about. It wasn't just a stepping stone to medical school, right? And I think that is exactly the way to think about, like, if students are going to pursue a master's program, to get something that you're happy in and are really passionate about, not just something that you think would look good on a resume. And that's what I say all the time, right? If someone asks me like, what will medical schools think of this? I'll say, is it what you want to do? Right. Because I think that's most important. So I appreciate you sharing that piece. Awesome. So at this point, for any of our folks who are watching, if you want to drop questions in the chat, you can feel free to either send them to everyone or just to me. I have some additional questions for our panelists, but I want to know what you want to know. So feel free to drop those in the chat. In the meantime, I'm wondering a little bit about, for those of you who have either started or are going, like, have completed the application process, what was that experience like for you? What do you wish you had known before you started the application process for your programs? Does anyone want to jump in there?
I would say request your transcripts early, because I kind of got like a little like my application got like pushed back because my transcripts weren't in yet. So, and that like it opens, like, I'm not exactly sure the dates, but it's open sometime in May, and then it's like you can hit submit and it goes out in June. But if your transcripts aren't in, then it's like your application doesn't go out to medical schools. And so I hit submit, and then they got back to me and were like, and AMCAS was like, oh, sorry, like you don't have your transcripts. And I was like, no. And that took like a couple of weeks to like sort through. And then by the time that happened, then it was like, I was like, I mean, I wasn't like late in the cycle, but it was like I had wanted to be like first in line. And then I was kind of like, not like mid in line, but it was just like I lost like the edge that I wanted, but obviously like it worked out fine. I'm okay, but just like save yourself the headache and like request those early. It's like my biggest advice.
That's great advice. Thank you, Sarah. Jenny, did you want to add something?
I mean, I second that sentiment because I also had issues with my transcript, and CASPA ends up inputting your grades into your application, and sometimes they can get it wrong, which is frustrating. So it's just good to like put it in early, and also to apply earlier in the cycle. I had applied later, like towards like July, and even though it's like not late in the CASPA cycle, it's still a lot of like, because this year was weird because of the pandemic and they had started interviews earlier, they were able to do more interviews. So like my like application kept getting pushed back because of like the way things were running for rolling school.
Thank you, Jenny. I really appreciate it. So I guess, oh, were you still going?
No, sorry,
Okay.
it like a second.
That's okay. So we have a question in the chat. How early should we request the transcripts? So I would say a couple of weeks before you hit submit. So I would say maybe as you're working on your application, you can go ahead and request those transcripts and have them sent, even if you haven't hit submit yet. Would you agree with that, Sarah?
Yeah, I would definitely agree with that. I didn't like request them until like a few days before I hit submit. And so like, you know, a lot of time, like I think Simmons was pretty okay, but because I went to like 3 different schools for like my like prereqs and all of that, because I had to take summer classes like in between my sophomore year. So it was like I went to UNH, I went to USM, I went to Simmons. So it was like 3 different transcripts that I was trying to get in, and all of them were like different processes, and it was just like a headache. But yeah, no, like because they allow you to like ask for them as soon as like you open it up. So yeah, I would go ahead and just do that, you know, as you're filling it out. That would be my advice. Yeah.
Yeah, and I think it's important to remember that once you've started an application, they have a file for you, so they can attach your transcript to like your in progress application, right? So it won't like get lost if you haven't submitted your application yet, because you're already going to be in the system because you have like an AMCAS ID and all that fun stuff, or a CASPA ID, right? Awesome. So how about any of our other panelists? Things that you experienced during the application process, things that you wish you had known before you started the process?
I can give something here. I was trying to like rack my brain for things that I feel like I didn't know, but I am a big planner, and so Sarah can attest to this, that I was just like, okay, tell me everything that's going to happen, exactly how it's going to happen. But one thing that I wasn't really expecting was the possibility that people that I asked for letters of rec would ask me to write the letters of rec. I don't know. I mean, this didn't happen with any of my academic, you know, professors who were writing, although there were like applications type things that I wrote up for some of them, which I assume pulled from. But some of my professional letters were coming from people that I work with at Fenway, and Ken Mayer, who is the director of TFI and a bigwig MD in the HIV world. He was like, yeah, just write something up. I was like, oh, okay. So I had to like learn how to write about myself and kind of like talk about my strengths and stuff like that in like in a different way than a slightly different way than like application writing, it felt like. So that could happen. Don't get spooked by it. Learn how to, you know, write a fantastic letter for yourself. I think that's a cool opportunity.
That's a super cool opportunity. And a question I get a lot from students is like, what the heck do I do with this? I almost would recommend it, like if you're thinking about like an exercise for yourself to build self-confidence, or to really, maybe write yourself a letter of letter of recommendation to yourself, right? Or for yourself, right? That could be kind of a cool self-confidence thing. I know sometimes when we, especially when we struggle with things like imposter syndrome, or like we're advocating for ourselves, oftentimes will tell students to write like the braggiest letter they could ever write about themselves ever. Like brag about everything. I mean, you're not going to send it to anyone necessarily, right? But then like give it to someone you trust, and ask what they think. And a lot of the times, if you're worried about bragging, you're probably not going to do it, right? If you're like concerned and self-aware enough that you worry you might brag, and that other trusted person will tell you if you need to dial it back, right? I don't know if I necessarily would send that letter to the bigwig MD right away, right? But maybe give it to a roommate or a friend or a partner or a family member, to have them read it, and they'll tell you if you need to dial it back before you need to send it up. So that could be a really good exercise as well. Just learning to see how other people might see you, right? Awesome. Anything else you wanted to add, Zahra? Anything about the application process that surprised you, or that you wished you had known earlier?
There was nothing super surprising. I applied like really early.
Mm-hmm.
I applied like the day they started accepting applications. I had my like secondaries by July. I think the worst part was like just waiting for interviews, because I had like at least a 2-month wait before any school even started sending out interview invites. So that was like the worst part, I think. Yeah, I think like I also sort of, when I decided I wanted to go for this MD program, I kind of like made a checklist for myself of like what I want to do during my time off from school, and a lot of things were just like taking the MCAT and getting more clinical experience, because I hadn't been in a hospital in like 4 years, so I needed to like show that I can like interact with patients and actually like be comfortable in a clinical setting. So that was like a significant like sort of thing that I needed for my application, and I got started on that like early on, like as soon as I graduated and I knew I was going to do this. I started putting together everything, and that really helped, because like in the end I wasn't rushing to like get clinical hours or shadowing hours or anything. Like when I started writing my application in March or April or whatever, I already had everything I needed. So that, I mean, I also took 2 years off, so I did that deliberately so that I wouldn't have to rush, because like I didn't want to apply unprepared. But that was really helpful. I think if I would have planned it better, or if I had known earlier that I wanted to apply MD PhD, I would have started getting the stuff together like my senior year of college, and probably would have gotten away with just one gap year, but it worked out in the end. It's fine.
Awesome. Thank you so much. So I certainly can ask a couple of questions, but is there anything else that our audience wants to hear specifically about? We've talked a little bit about the path to applying. We've talked a little bit about the application process and what folks found surprising. Um, I'm wondering, to our panelists, what experiences did you have in your growth year that really stand out to you, that you found, that you find yourself either thinking about a lot, or you found particularly foundational? It could be literally like a moment with a patient, or it could be like a whole job you had, or something like that. What's something that you think you gained from that experience? Anyone can feel free to jump in.
I'm gonna jump because I feel like I'm really excited about this. I feel like my whole master's program experience has been life-changing. when I first started, I was like the youngest in my class, so I had like a round two of imposter syndrome. Um, like there was like a 40-year-old doctor in the front of the class. Somebody beside me had been working like Intel for 10 years. And they asked me like, "Oh, what was your career?" And I'm like, "I don't have a career. I just graduated from undergrad." And that I feel like just being in a class where everyone came from a different path has really helped me in learning who I am as a person and just like what I want. And I feel like it's different from Simmons because when you're at Simmons, everybody's on the same path, so or kind of like on the same level. You're all similar in age, and when one person freaks out, everyone else freaks out. But then here I am in my first semester of a master's program, freaking out. And then I have those who are like older than me, just telling me to like relax and chill out. So I feel like I had advisors and mentors, but they don't know that they were my advisors or mentors. And they kind of just like set a precedent for how I would just go about myself and like how I would approach my studies. I feel like I relearned how to learn again in my master's program. I got introduced to a lot of different like backgrounds and pathways that I never knew existed. I my mental health, oh my God, mental health. Everyone keeps talking about mental health, but they unless you like go through a journey, like you don't know what you're talking about. My mental health has improved so much in these past 2 years that I am I wish I went through this change in college, but I feel like if I never went through this growth phase or this like or in my MPH program, I would have never, I don't know. It's just I don't even know how to explain it. It's so hard. It's like your mental health improved, but your outlook on life improved. And that helped now what I'm like thinking about applying to medical school. I did go through the application process, so I have like an application saved. But when I look back at it, I'm like, I wish I had the confidence in the mental health that I had. I'm now looking back at the application and being able to fill it out. And I'm so happy, but I love bragging about myself. Um, I after like leaving Simmons because I feel like I'm comfortable doing that and I'm just sure of who I am. Another experience that I think is really helpful is Simmons is majority female women, and in grad school there were men in my class and cis men. So I feel like adjusting to a co-ed environment has been so hard, but so needed because when I was at Simmons, I was really outspoken with my classmates, with my friends. I didn't really have to worry about how I say things or just like my thought process. But then I kind of had to go through another regrowth phase and kind of my confidence came from their arrogance. I'm not gonna lie. So I'm I'm like happy that happened.
That's
and
the women-centered education speaking.
so I feel like I needed that. And then now, like when we were finishing our program and everyone's thinking about like different phases to go to, I kind of feel like I've grown up and I'm able to handle stress in a way better way than I've never been able to be before. And like I have a better, I found my support system outside of Simmons, which I think would be important if you are applying to medical school or going to medical school, because what if I went to medical school right after Simmons and I hit those patch roads and I didn't know how to handle myself, I didn't know who to go to, I would just like completely crumble and I wouldn't be as I wouldn't be successful. So I feel like that's why a growth year is important. So you can find out who you are outside of academia. Even though I was in academia, I liked what I was doing a lot and I had more time to be social with others, that I know who I am outside of like learning and being in school 24/7. And then now I'm going back to school, I'm sure of myself. And if I hit those patch roads, I'm like, I can go off running.
I love it. Thank you so much, Asha. I think we don't talk necessarily enough about the mental health benefits of taking a break from like full undergraduate coursework before going on to graduate school. And so I so appreciate your perspective there. Anyone else? What is an experience that has stood out to you? Yeah, Shay, go ahead.
Just hopping off of the what Asha said about mental health, I think that taking a break from academia was really, really important for me. But that wasn't what I was going to say. I just want to second that. I have two experiences. The first being my transition from a research assistant to study coordinator. It came right after we started in-person work again after COVID, and it came with like a lot of responsibility, just like a responsibility dump. Like, there you go. The person who was in the position prior just left for med school, and it was kind of just like all on me. And I grew so much, like really rose to the challenge sort of thing. And like the professional development that I have experienced through that kind of promotion has been like really, really incredible. To think about where I am now versus where I was when I started as an intern who like sat in the corner and just did quality control and didn't talk to anybody is incredible. And the second piece that I think I would be remiss without mentioning is working through COVID in the healthcare setting. You know, I was one of the only staff who wasn't furloughed on our team, and had to kind of manage how to remain engaged and remain providing healthcare to the folks who we had engaged in study, and the like shift of our, all of the infrastructure that is in place for HIV research was really like overnight transformed into COVID research. It's all the same people working on these other studies, and it was like incredible to see the like intelligence and passion behind the research, and like the drive to get it done with warp speed. I am not joking when I use that phrase, like incredible speed. And it was just like really solidified kind of like, yeah, I do want to be in healthcare. This is this sort of thing that I want to be doing, and the people that I want to be surrounded by. So that was, I would never have had that had I, decided to pursue something else, or not taken that growth year. I wouldn't have been, in it for COVID. And I think that really helped me, solidify that it is what I want to do.
Awesome. Thanks so much, Shay. Anyone else have like an experience that you really look back on and are like, yeah, this is something that really impacted me during my growth year?
I'm happy to talk about something.
Yeah, go ahead.
I have sort of like two experiences. I would say one of the most like interesting thing that I did during my growth year was that I became a yoga teacher. I had been doing yoga for a while, and I sort of just like had taken the jump to do it during my first application cycle. And I just thought, what could I lose? Through like the teacher training program, I sort of like started building more confidence in myself and like learned how to like use my voice, and like and which resulted in me like having more direct language rather than like speaking passively than actively, and being able to recognize that. And taking that confidence like from like teaching yoga, I like really helped me when I started my new job. I started my new job like in the middle of the pandemic, and it was like a little weird because we were like short staffed, and like we didn't have a manager. And I was like this new person starting on like this new floor without like almost a concrete training program for me. But like with all these like new challenges, I've learned how to like advocate for my and like advocate from like in like a hospital environment, and like really like learn how to talk to like the different providers on like developing like different programs. And I was able to train new staff members that was able to come on board, and it has really like shown my growth. Like it really like pushed me to like do more and like problem solve and like work within a team. And I really wouldn't have these like experiences if I didn't take my gap years. And I'm like really thankful for it, that like I had the experiences where I was able to grow and mature and like learn how to build my voice.
That's awesome. Thank you so much, Jenny. And thank you for sharing something a little, I mean, not that others haven't, but sharing something a little unconventional that we might not think about. I think that's really cool. And it's another example of why you should pursue things that make you happy, right? And don't just think like, what will PA schools think of this? What will med schools think of this, right? I think that's in a perfect example of working with it and building skills that would benefit you, right? You're still working with people. You're still working with people in terms of like getting healthy and reaching some goals they might have and those types of things. So I appreciate you sharing that. And also I want to say I see a difference in the way you speak. So I actually, from when we first met, so I think that's really cool that you can pinpoint that. That's awesome.
That's exciting.
Yeah, absolutely. So anyone else want to share something that was really impactful during their growth time?
I guess I could
Yeah,
go.
go ahead.
Yeah, I mean, I guess I mentioned that I moved out to Los Angeles right after graduation, and it was definitely like, I had like professional jobs like in healthcare and then research. So it was like, I was still like building my resume, but I think just the life experience of just making like that big move like that was kind of like, it really got me out of my comfort zone, and it really kind of forced me to I feel like mature in a way that if I had like stayed in Boston, I probably wouldn't have experienced that. And, I had a lot of like fun memories now that I can look back on, from my time out there. And yeah, and I guess like, but I'll also, it was all fun and great and like, LA, woohoo, but it was also scary at times because I didn't know exactly like, I think that's the one big thing when you graduate is there's no one set path of what to do next. And I think that's something that I certainly struggled with, was like, okay, what do I do now? And it was like trying to figure that out and like, bring all these pieces and like find a path to where I want to go was definitely challenging at first, but I feel like going through that, like I'm a lot more sure of myself and I know like what I want, and like I know that I'm willing to like work really hard to get to where I want to be. So I think, as much as a growth year is about, like I feel like we've all kind of like echoed this, as much of as a growth year is about like, building up like your experiences and like making your application better, it's also about growing as a person. So
Absolutely. Thank you so much for sharing. I appreciate that. Zahra, anything about your time at Princeton or maybe something else that you were doing that time that really stands out to you?
I guess like there would be two things that I would.
Could you lean
one
in?
is-
Oop,
Oh,
you lean in just a little bit more. Thank you.
okay. I guess there were like two things that kind of stood out to me. Thinking back, like what I've done in the past 2 years, but one of them was like I did this like summer clinical program at a hospital, and like got to like volunteer and shadow in a bunch of departments and stuff like that. So that was like the most like immersive clinical experience I had had so far. And that really kind of like solidified like why I wanted to do medicine, and not just like research or biomedical research or whatever. So that was really cool. If like, I wish I'd had the opportunity to do that sooner. But it was like the summer before I applied to med school. So it was, I mean, it like counted towards my like clinical experience in my application, but like it would have made things a lot more clear early on. So that was a lot of fun. The other thing I got to do at Princeton was like actually like write our own manuscript and like publish papers and stuff like that. And like just doing that also made me realize that I also want to do research, and like this is fun. Like I feel like a sense of accomplishment when I do this. And that it has like that, like the world can see like what we've done so far and how it's like changed things and stuff like that. So I think that was really cool, and that has helped me a lot in grad school as well. just like knowing like what you need to do to get to that point, and then like how to get, you know, one step further and like actually like send your paper and like the whole process. So so yeah, so that was also very cool. Yeah.
Awesome. Thank you all so much. I really appreciate your thoughtfulness and your insight. And I'm so excited for all of you because I know you all have huge achievements that we all are celebrating in different ways. But that's really exciting. I hope you're taking time to celebrate those achievements, even in this weird world we now live in. But I want to, I know I speak for everyone when I say thank you so much for joining us on a Thursday night. And we really appreciate your insight. So if you could all join me in the comments or coming off mute, thanking our alumni for joining us. Thank you all so much and have a great rest of your night. Stay safe and healthy.
Thanks, Sarah.
Of course, if anyone wants to hang on for a sec, I'll be here for a minute or two. But feel free to pop out. Bye. Thank you. Thank you.
All right. Have a nice night, everyone.
Good night. Bye.
Thank you. Thank you. All right. What's up, friends?
I wanted to tell you that I remember when I was still at Simmons, you sent out an email about the point scholarship, and I was like, I'm going to apply to this. So I saved it, and it was in the depths of my Simmons email. And before my Simmons email got deleted, I forwarded it to my new email address, and I applied, and I'm in the semifinalist round.
Shay, that's amazing.
Yeah,
congratulations. That sounds like an incredible program.
It really is. The more I think about it, the more I'm like, this would be amazing for me. So I'm really excited about it. I will apparently hear about interviews on the 15th. So keep your fingers crossed for me.
They're crossed. Congratulations. That's a huge achievement.
Thank you.
That's amazing. And do they provide support while you're in school? Not just financial, like do they provide like mentoring or anything while you're in school as well?
Yeah. So
amazing.
The program is like, you know, there's the financial aspect of it, but then there's also, you get paired with a mentor. You get to do like professional development and leadership kind of conferences and workshops.